So, Dr. Ohan, it's great to get a chance to talk to you because you've been in the business a really long time. So you've seen, I'm sure, changes in the industry. And so can you tell us a little bit what your clients are asking for now and getting those results?
It's good to see you here, Amanda, at
Thank
Hadley
you.
Street. It's always a pleasure to meet you here. I'm looking amazing today.
All because of him.
So the trend, the changes happening in the industry is all about looking fresh, looking natural, combination treatments that just to look, glowy all the time without looking overly done, overly filled, looking, just subtle effects.
Yeah, that's a big change because there was a time when it was very sculpted, wasn't it?
Yes.
And very sort of lifted in the eyes and that type of thing. And that you see is
Indeed.
changing.
Yeah, you still have some age group clients, they're still asking for that look, but the majority now is just looking fresh so that nobody has noticed that they've done anything. So it's that not overly done look, avoid it. Sometimes even we dissolve some of the old fillers, and start fresh so that we look very, very subtle and very natural.
Yes, that youthful glow, right? So how do we achieve that?
Well, yeah, that's the trend, as I said. It's all about looking glowy and looking fresh. And we can achieve that through different ways. Now, it's very important to listen to the clients. And clients that come, they just want to look just glowy, for example. So the most important thing is just to examine the patient, examine the skin, see what's their concern, look at the skin tone, the complexion, the hydration, if there is any volume loss or not. But in general, to get that glowy skin, it's a combination treatment, starting from your lifestyle, followed by your skincare, and then injectable treatments. Then you do the laser treatments like the Morpheus 8.
Yes.
But it's all about combination.
Yeah. And because technology has really advanced so quickly, hasn't it? It's really taken over some of the more traditional ways of having a facial, for example. It's now Hydrafacial, which is a great one, isn't it? All the boosters and things in it.
Absolutely. So Hydrafacial is considered one of the first steps to prepare the skin. So have your from the name, so Hydra is hydration. So you add hydration to the skin, makes your skin look nice and glowy and ready for the injectable treatments. So what we mean by injectable treatments start from the most popular treatment, which is anti-wrinkle injections, or what we call it sometimes Botox, the brand. That helps to reduce the wrinkles, soften the wrinkles, gives you that nice glowy fresh skin, but followed by other new trendy treatments like polynucleotide. It's number one treatment in the market now.
So what is that? Could you explain a bit more for us?
So the polynucleotide is basically it's a skin boosters or biomodulators, which means you're injecting something into the skin. The word polynucleotide is derived from small fragments of the DNA, which they fragmented from fish, from salmon or trout. Yes, yeah. So they fragmented in a very clever and smart way. Obviously, they removed any proteins which cause allergic reactions. And then we inject it back into the skin. And that will help to create the best environment in the skin so that the skin cells will work very, very efficiently to produce more collagen, more elastin. So these two active ingredients or main components in the skin, when there's more collagen, more elastin, you will have less wrinkles, the skin will look more glowy.
And how does that compare then to Profhilo? Because that's been the precursor to this, hasn't it?
So yeah, I've been using Profhilo for the last 5-6 years now. It's a fantastic treatment. It's not a filler, although it's made of hyaluronic acid, which is the same ingredient, fillers, but it's the consistency is different. The technology that produced Profhilo is different hyaluronic acid consistency-wise. So it works it's like, I call it like moisturizing injection. So think about your moisturizing you put on the skin, mainly contains hyaluronic acid. We put it in a syringe. Think about it like, to keep it simple, inject it back into the skin. So this hyaluronic acid under the skin will help to absorb water.
It's 1,000 times more potent than just water, isn't it?
Exactly. So one molecule of hyaluronic acid absorbs 1,000 molecules of water.
Fantastic.
And you have that in your skin.
Yeah.
But unfortunately, as you know, as we're getting older,
yes,
including me, it's just we start losing hyaluronic acid. So that had more of a glow to the skin. So back to your question, what's the difference? Profhilo is hydration with a bit of collagen stimulation, while polynucleotide, which is the latest in the market now in the industry, is more of collagen elasticity stimulation, more of wrinkle reduction with a bit of glow as well. Obviously, you can do the combination. You can use it upper face, your neck, hands, anywhere.
It's fantastic.
Yeah.
So that's a really good sort of general enhancement for the skin. But then there are other things where you can enhance areas. So
Yes.
like your lips and jawline and these things.
Yes.
And they become quite a trend. But of course, your face isn't a trend, or shouldn't be seen as one, should it?
Definitely. And unfortunately, nowadays in social media,
Yes.
especially at certain age groups, they are affected by these trends. And obviously here where it's very important to have a proper consultation with a doctor, with a specialist. So we always do a proper consultation, at least 20-30 minutes. Listen to the client, see what they are asking for. And for example, lips, it's very, very trendy. And I've seen sometimes clients, they come and they have a beautiful lips. So through thorough consultation, educating the client,
Yes.
sometimes they don't need the fillers. So sometimes the small changes around the mouth, for example, the corner of the mouth,
Or the barcode lines
or the
and things
barcode,
can help.
exactly. So the barcode where there's the vertical wrinkles around the lip area, that helps to, we can use a bit of botulinum toxin and wrinkle injection to soften them. We can use a bit of fillers. So it's not always the lip itself. And we always have a look at the whole face. So you cannot have just your fillers and ignore on the lips and ignore the rest of the face.
Yes.
But I like that less is more. So just to use a small amount, small changes, and then look at the whole face.
And that goes on nicely to, we were talking about combining treatments, layering it up. Can you tell us a bit more about how that works?
So the combination starts from your skincare, plus a bit of your toxins, the anti-wrinkle injections in the upper face, a bit of fillers in the cheeks if needed, volumization, as we said about the lips, around the lip area, doing a bit of fillers, followed by skin treatments like polynucleotide Profhilo if needed, if there is like lack of hydration, fine lines and wrinkles, stimulate collagen at certain age groups. And obviously then going a bit more step up, going more Morpheus 8, which is a treatment of combination of microneedling with radiofrequency.
Yeah, and there's more downtime with those types of treatments, right? So as you go along. And also there are treatments that you've got really that cover all age groups, aren't they? So acne, scarring, rosacea, as well as the collagen loss and bounce.
Absolutely. So for example, acne scars, Morpheus 8 is very good. Skin pen is very good. Yes, it's a microneedling to stimulate your own collagen to reduce the depth and the size of the scars. That's very good for acne scars. For rosacea, we have the Lumica, which is our new add-on treatment to our clinic.
And what's that?
So Lumica is an IPL. So it's not laser, but similar to laser. So IPL is intensified pulse light, which is, from the name, it's a light, but it's very intense, it's focused, and that helps to zap all the veins, thread veins on the face. People with rosacea, they have that. If they have pigmentation, sun damage, for example, especially nowadays after summer holiday, people that come back with sun damage, so we can zap them with IPL, which is Lumica.
And you have it on your arms as well.
Of course, yeah.
That's where I tend to
absolutely.
pick it up.
All these little tiny freckles usually gets worse as we're getting older. It's all sun damage.
Yeah.
So Lumica is one of the treatment that we can do here. But back to the combination treatment, you can combine it with very important skincare. So your vitamin C, your SPF, which I would call it your best friend. So definitely SPF 50 to protect your skin. So always think about protection and prevention before treatment.
And hydration.
And hydration. So you're moisturizing care, absolutely, obviously. Yeah, definitely.
One of the other things I wanted to talk about is filler, because filler has been a very long-term treatment that we've been used a lot over the years. And I think there is a mixed view from patients about how it might make you look afterwards. And I think it's important to understand that I think that's moved along quite a way now.
Looking very natural, tweakment, looking refreshed rather than overly filled.
So still including it, but using the more technological treatments to get the overall look.
Of course, filler is still popular treatment, but less amount of fillers. So using small amount in the cheek area to give you volumization, but not looking too fake or too much of.
And also, I understand you can use filler around the nose.
So in the nose and around the nose. So in the nasal, in the nose. So in some cases, so obviously we cannot compete with our colleague surgeons where they do a great job. However, but for some minor issues, like for example, if somebody's having a bit of hump, which is not straight nose. We can put a bit of filler to make the nose straighter. We can use a bit of filler underneath the tip, another tip to lift the nose. But obviously there are limitations, so it's not for every single case. And again, back to the consultation. First, have a consultation with an experienced doctor, and then it's very important to manage expectations. We are not doing surgeries. It's a non-surgical rhinoplasty, but it's amazing results for the right candidate.
Yeah, it's moved so much, isn't it, in the last 10, 15 years.
Safety.
Yeah, so I mean, from my personal experience working with the team, having my skin looked at and improved a little bit here and there, I've got more confidence in myself and in my skin, and I actually wear less makeup, funny enough, these days, because my skin's in good condition. But it's also confidence in the practitioner. I know that you take pride on safety and care for your patients. You're a GMC registered doctor, and I know that when I have treatments with Dr. Ohan, he's always sterilizing, and you've got gloves. It's very important to you, isn't it?
Yes, it's very important for safety. So the patient safety, patient care is our main, it's paramount for us. So any doctor, GMC or GDC, dentist, they go through a yearly appraisal. So annual appraisal to make sure that they are fully trained, they follow the guidelines of the GMC. All our doctors in the clinic, in Swiss Care Clinic, they are fully GMC registered. Available every day, so 6 days a week, there's always a doctor's.
Because I've had experience of the call centre after having a treatment, especially Morpheus 8, it was a new thing for me to have something a little bit more invasive, let's say, and I wasn't sure that the amount of redness I had afterwards was okay or not, and literally within minutes of making the call, I was on the phone with Dr. Ohan, and of course everything was fine. But those are the things that actually patient care is when you're not thinking so much about that when you make your initial booking, but it's actually so important to have aftercare.
Of course, especially with advanced treatments like the Morpheus 8, Silhouette Soft. So there's always, as I said, available doctor in the clinic. And if I think there is any issue, they're more welcome. We'll just come back, we'll review it, reassess the area, re-examine if any treatment needed. On the spot, we can prescribe anything just in case, because as any medical treatment, there are possibilities of side effects. And during the consultation, we discuss that. As a doctors as well, we have our reputations. I've been in the industry for 16 years, and we really enjoy it. And I love the team, and it's a pleasure to be as a part of this team.
Yeah, that's lovely to say. Well, thank you very much, Dr. Ohan, and that's it for now. Thank you.
Thank you very much.